If you're a young athlete who has chronic low back pain that you worry is going to take you out of the activity or fitness things that you do that you love, then check this out. You may have adhesion or nerve entrapments that just need to be diagnosed and removed. In this visit, you're gonna see my good friend Jess, who has been a patient of ours for 6 or 7 years or so, and she is currently in longevity care. What that means is that when we first met her, she had significantly more pain in various areas of her body, her low back, her knees, I believe. Now we see her less often, about once a month, in order to keep her body well. As a previous roller derby athlete, she has various degenerated joints, and she wants to stay healthy and well into old age, and she knows that when she keeps her body active and is staying strong, but she doesn't come in for treatment to remove the adhesions, the pain starts to build back up over 2 or 3 months. So she comes in once a month in order to get care, in order to keep her body well and to keep her healthy.
Do you have anything in your low back right now just standing here?
So low back wise, it had been getting stiffer because I'd been sleeping on my back, but I actually had a physical therapy appointment on Saturday. And I got a cupping treatment done, and that's helped with some of it. But there's still restriction in my range of motion. Like if I do like the backwards bend, I'm only going like this far, and it's just like
across both sides.
Yeah, it's across both sides, just like that.
0 to 10 when you go backwards.
Probably a 3.
3. Got it. 3. What do you feel here?
There's just kind of like a line of tightness that runs like through here.
All the way down?
Yeah.
It goes past the knee into the calf?
A little bit, yeah.
0 to 10?
It's really like a 1 right now.
A 1?
Yeah.
And then does this increase it?
Yes.
Okay. And what about this? Does this do anything?
No, it actually feels just kind of like relieving almost.
Got it.
So her L5 nerve root on the medial side of the psoas, I'm getting deep and medial to it, and this is stuck.
Yeah.
Go. Good. This is LFC on the iliacus, so this nerve comes out this way and goes this way. And I'm deep, almost near the iliac crest, and I can't push it up towards her head, so. A lot of times on social media, especially doctors and therapists will comment, you can't possibly feel those nerves. I don't know what to say, how obvious and easy it is to feel these nerves when you know what you're feeling for. They are very specific things going in very specific directions with very specific densities and dimensions. There's an angel hair pasta running from the L3 nerve root going out towards right underneath her ASIS, at which case it goes just lateral to the rectus femoris and goes down vastus lateralis all the way down to the lateral knee. That is the lateral femoral cutaneous nerve. Just because you haven't been taught as a doctor or therapist how to feel these nerves and how to work through the intestines and the bowels and all that doesn't mean that it's not physically possible. What we do with Adhesion Release Methods is we teach doctors and therapists how to feel for these nerves, how to locate the nerves, how to check if they're stuck, and also how to treat them and remove the adhesions there. I very easily just found the lateral femoral cutaneous nerve right on the front of the iliac crest. I do this all day, every day.
Yep.
L5 nerve root, medial psoas, moderate to severe, and LFC on iliac crest, moderate to severe.
Yeah, the restriction on the left side is like pretty much gone in terms of the back bend. The right side, I still feel that restriction.
Got you. Slide back.
Mm-hmm.
There you go. So you have this. She's got like a little golf ball right here.
The golf ball is a hypertonic group of tissues. Some people would call it a trigger point or not. We don't treat those directly. We find the nerves right around the golf ball to see if we can make the golf ball get smaller and release it from visit to visit. That's how we know we're being effective. If the golf ball stays the same size every single visit, that bundled up group of tissues, she's gonna continuously have low back pain that bothers her, and she's going to be in our office way too often, and in which case now she's only coming in every once a month or so to keep herself well. That's how we know that we're serving her well, is by making her tissue softer and healthier because the golf ball goes away. L4 psoas, moderate to severe.
Okay, all that low back stuff is like gone. The only thing that's a little aggravating now is like as I got deeper, there's like right here, I don't know what that structure is there.
The doorway.
That bugs me.
So the subcostal nerve, there's a branch of subcostal nerve that comes over the QL. And I think that's what she's pointing at. I'll start down here. Go ahead, James. And drop the knee down.
In the past couple years, I don't know if I've ever treated a straight up QL adhesion. One of the nerves that's on top of the QL is the subcostal nerve, has a branch that pretty much goes down the lateral side of the QL. And in this case, it was entrapped and stuck, and she was pointing right at it. This is what I'm treating, and this is what will allow the QL to immediately relax so that she doesn't have to stretch her QL every day, every week, every month for however many years some people decide that they're gonna do that.
Go, James. Drop the knee down. Keep going. Good. Come on up. Call it the lateral subcostal nerve at the QL. She's 2 gases. Moderate to severe.
Yeah, that feels better. Thank you.
You're welcome.